Hi Becca, it's Anne. Thank you for your video that you posted. Actually two since I've posted. I love it that you're encouraging the whole world to listen to the Star Legacy podcast with Dr. Clemmens. You probably, now that you've listened to it, understand why it was like this huge moment in my life and really helped start to connect a bunch of dots for me. So thanks for listening to it. It was a big deal in my life and in my story. So yeah, I would love it if everybody could listen to it, but especially like lost moms who lost full-term babies who don't know the cause of their baby's stillbirth. I think it would be really helpful if we could somehow reach those moms and encourage them to listen to this podcast in case it points them in some interesting directions. Or moms who are pregnant and who are, third trimester, and just the importance of baby size to the placenta size, the fetal placental ratio. I wish every pregnant mom had that measurement done. Anyway, I should let you know it is currently 1:50 a.m. right now, right here. So since I've always been a night owl, but more like midnight, go to bed, night owl. Since losing Elijah, my sleep schedule has been completely whacked out. And at first it was because just the trauma of everything and like replaying the horribleness of it in my brain. And I just really struggled with sleep initially because of sort of those, I call them my trauma videos, like replaying in my brain. And that it's not that anymore. But now it's like my brain just spins with like advocacy ideas or my next research questions I want to ask, or I don't know, it just, my brain won't rest sometimes, which is not good. My brain needs to rest, but I feel like I have a choice between forcing myself to go to bed at midnight and then sleeping for a few hours and then laying awake being annoyed that I can't sleep, or just waiting to go to bed at 2 a.m. and then I'm so exhausted I just sleep like a rock until I have to wake up the next morning. So it's not ideal, but I wanted to explain that. So if my eyes look bloodshot, if I'm yawning, that's why. Having said that, I'm pretty excited to continue this conversation with you. Again, like every other video I've made, and I suspect you too, there's like 50 million things that I wish I could share and ask you both, and I can't. So I thought, okay, I'm going to pick like 3 things that I'm going to dive deep into. And so the things I don't address are not me trying to ignore you, but I guess I'd rather, this is a marathon and not a sprint, right? So I don't have to go into, don't have to talk about everything. And so I'll get back on some of those other questions and comments where so many things you shared were so interesting. Okay, one question you asked was, you mentioned you're going to go to that placenta clinic and hopefully talk with somebody, and you said, what are some of the resources that you might bring to them? And I thought, quick framework of convincing care providers, small placentas matter, and EPV is a tool to measure small placentas. Those are the 2 basic links that you need, that a care provider should want to solidify in their brain. Number 1, that small placentas are a big risk factor, increased likelihood of stillbirth, and EPV is an accurate, simple, cost-effective way to measure placental volumes. Those are the 2 things you're trying to basically teach. Because, even a lot of patients think, all these OBs and maternal fetal medicine specialists or midwives, they're on top of all the research and they know everything. And that's frankly just not the case. A doctor can't, they don't have time to stay on top of everything and all the latest research. So part of that's our job, and say, hey, look at these interesting published papers. what do you know? So one paper I absolutely have to show you. This is the first of those two links, linking small placentas to a very dramatically increased likelihood of stillbirth. So I printed off the first page just for a little visual. Maybe it's going to be backwards. I don't know. Anyway, it's placental weight for gestational age and adverse perinatal outcomes. If you go to Google Scholar, you can get this full paper for free online. So I would highly recommend printing it out. For anybody, any care provider you're going to talk to, print out this paper and especially go to graph 1A and highlight the heck out of it and show them. This graph shows small placentas are linked to very, significantly higher risks of stillbirth. And this is a really good study. First of all, it was done in Canada, so that's cool. In Montreal, I believe. There were 93,000 births in this study where they measured, not only the placental weight, but a whole bunch of things. And then the birth outcome, was it a live birth or a stillbirth or complications after birth? So that is a huge number. They should be impressed by that. It's also published in one of the leading journals. It's Obstetrics and Gynecology. That is one of the top journals that OBs would be reading. Done by a researcher. The lead author is Jennifer A. Hutchian. So anyway, find that paper online, circle and highlight, read it and understand as much of it as you can, but give that to the care provider and say, listen, so graph 1A, there's a million interesting things in this paper, and I want every OB to read this paper. But if you look at graph 1A, among other things, it says, if you're a patient that has just a very average, 50th percentile weight placenta, your risk of stillbirth, ignoring all other factors, just looking at placenta weight, your risk of stillbirth is about 2 out of 1,000. Just for comparison, I know that in the US, the stillbirth rate is 6 out of 1,000. But if your placenta size is just right in the middle, your risk of stillbirth is much less. Although we're comparing American to Canadian populations, so that's not strictly true. That's not the best comparison. But anyway, it made me wonder what the stillbirth rate in Canada was. If you know that, I'd be very curious to learn that. So anyways, that's 2 out of 1,000 is your risk of stillbirth for just a very average size placenta. If your baby's placenta is let me get my notes, make sure. Yeah, if your baby's placenta size is 3rd percentile or less, your risk of stillbirth jumps to 15 out of 1,000. So in other words, your risk of stillbirth increases a lot just by being 3rd percentile or less. Now, you were asking in my autopsy report, how did I think to ask, but how much less than 10th percentile? I guess that just comes from my research background. In research, outliers and really small or really extreme values of any sort are really interesting. Sometimes they're really frustrating and annoying and you hate them, but they're real and you can't ignore them. And other times they are very interesting and have their own story to tell and need to be followed up with more questions. And so outliers are extreme values, and here placenta sizes, outliers and extreme values are very interesting because they're correlated with an increase in stillbirth. And so, I guess that's just kind of my research background to know that, because having a 9th percentile, because the stillbirth risk here in America at least is 6 out of 1,000, so that's a little over 1/2 of 1%. A 9th percentile placenta size just is kind of that's interesting, but not anything really to sink your teeth into. But the smaller or more extreme a value gets, the more you're that's really interesting and could be something worth looking into. So, what were the other kind of researchy questions? Yeah, you asked if there was some sort of like magic number. Unfortunately, I have yet to find a graph of like fetal placental ratio and risk of stillbirth. That would be really helpful. Maybe it's out there, I haven't found it. There is no magic number really. It's just as placenta sizes get smaller and as fetal sizes get bigger, the risk, sort of like a sliding scale, it shifts. And so there's no like cutoff point. I haven't seen like ACOG, the American College of Obstetrics and Gynecologists. I haven't seen any recommendations from them of like, this is too much risk, or, you know, start interventions at this level of risk, right? Like that would be sort of a decision that I would hope an OB would make in concert with their patient and looking at their history and all that kind of stuff. Really important is like, don't ignore it, because there is a risk that increases with smaller placentas, but there isn't a magic number, which makes this a little bit harder to deal with. But they're doctors, right? They should be okay with variables on a sliding scale that have more or less risk. It's part of the decision-making process. So, no, sadly, there's no magic number. But I wish there was. I wish there were recommendations by ACOG. I mean, but this honestly hasn't even been studied enough to have like really clear recommendations. But that doesn't mean we should ignore it. Yeah, so I don't know what risk is acceptable. You know, talk to the patient, talk to the doctor, because there's risks both ways of leaving a baby in utero with a small placenta, or you know, inducing delivery, you know, before 40 weeks or 39 weeks or whatever. Let's see. Yeah, and then you asked, why is Dr. Clemmens' research valid? And so by all means, that's the other paper you should bring to all of the people you talk to, is bring Dr. Clemmens' most recent papers. And I think it's pretty convincing research that his very simple, cost-effective tool is effective in measuring placenta volumes. Having said that, it's not like the only question you should be asking. It's more like a flag or like an indicator of risk. So if the volume is measuring small, you wouldn't say, oh, induce that baby right away. You would want to like compare it to the fetal size. You would want to start doing, you know, other measurements. Are there any signs of distress? What's the patient's obstetric history? How far along is this baby? You know, all sorts of questions. So, yeah, is it valid as a flag? Absolutely. It detects, you know, increased risk of a placenta being small, which we know is correlated with stillbirth. So, those are the two papers I'd recommend you show to anybody. Okay, that's me nerding out for a little bit. But, oh, I was going to say too, so I just had a meeting with myself and Dr. Clemmens and one other lost mom who is a patient of Dr. Clemmens and has indicated some interest in more advocacy and trying to get EPV research out there. And it was just another good meeting. I leave all these meetings like, this has to get out there. This has to be known. Now, unfortunately, there hasn't been like a really large scale study of EPV, so that's really kind of where I'm going next, is how do we launch that? How does that get funded? And that is a $1 million question, almost, you know, literally more than $1 million question. How do you fund it? Sadly, the prenatal, you know, pregnancy studies that tend to get funded, at least according to Dr. Clemmens, are the really like sexy, interesting ones, like, you know, really obscure test for something, or like the surgeries that you can do in utero that are like really, really interesting for maternal fetal medicine specialists right now, that cost like tons of dollars to even perform, you know, like one example. I also wonder too, like, there is no drug company that's set to, you know, make a notable profit margin or any profit margin off of EPV, right? It's 3 measurements on a very routine ultrasound. So there's no drug company behind it to fund or advocate for research. On some level, this is so backwards, but it's like EPV is so simple. People kind of look at it with skepticism, and skepticism is fine and good, but, you know, there's also a time and a place for just really common sense measures, and this would be one of them, I would say. So anyway, it was a really interesting meeting with Dr. Clemmens. We're hoping to have kind of regular meetings. One of my hopes, I have many hopes, but one of my hopes is that maybe Dr. Clemmens can connect with the people who wrote this paper, the small placentas and birth outcomes, stillbirth study. I thought it'd be nice if they could maybe collaborate, because it seems like she in Canada has access to some really big data sets, and this was funded by, I believe, the Canadian government or Institute of Health or something. So I was like, yay, go Canadian Institute of Health or whatever your national health organization is. So I was like, oh, maybe if Dr. Clemmens and this lady, Dr. Jennifer Hutchian, maybe if they collaborated, they could like launch some large-scale EPV study. Anyway, that's one of my dreams. We'll see. One of my plans is to email Dr. Hutchian and just ask her, I don't know, why don't you go study EPV with Dr. Clemmens? Why not? It seems like free to ask, so I think I'm going to email her. By the way, I've been pleasantly surprised the number of researchers who do actually email me back. That's kind of fun. I don't know, like, just a random aside. However, some do not. And I don't know. Then it's annoying. Then I feel annoyed that they're not emailing me back. Like, come on, I lost my baby. Talk to me. But anyway, it's all over the board. Okay, enough of the geeking out. I could probably do that forever. But we have other videos and I can share more. So, yeah, let's see. You talked about triggers and self-care. So, obviously with sleep, I'm not doing an awesome job. But I liked your story about 1 day a week for the first year after losing your Elijah. You took time for you. Like that, good for you. Did you have to like sort of force yourself to do that? Because I have a hard time imagining myself doing that. In part it's because I do have, living children who are young. They're ages 8 and under. And so I guess I don't really quite have that option. But I mean, in many ways, they have been, some of my biggest support in my grieving process, in that I do have the chaos and distraction of little kids running around, which in many ways is very good for my grieving process, because little kids do bring lots of joy and action and fun, and they wear their heart on their sleeves, and I love talking with them and my husband and just remembering Elijah together. And so in that sense, they're very good for my grieving process. But realistically, I can't just take off a day a week. That's just not going to happen. It reminded me of a quote that a friend sent me, and she said, parenting can make it hard to grieve, but grieving can make it hard to parent. And that has so resonated with me, where it's like, sometimes I wish I could just have a day away, and occasionally I do. I get at least chunks of time, like hours at a time away, where I can grieve. But parenting young kids can make it hard to grieve, even if they're also my best medicine for my grieving. And yet also my grieving makes it hard to parent, where like sometimes when lack of sleep, that makes it harder to parent. But also a lot of times I find myself just kind of staring off into space. I was wondering if is that something you ever dealt with? But like, I'm just my mind wanders so much more than it used to. It's just, I find myself staring at a wall, and then I zone back in, and I'm like, gee, I think 10 minutes just passed. Are my living children still alive? I mean, I don't think I'm like that out of it all the time, but I don't know. I find myself just having a hard time sustaining focus sometimes on like things that are happening right around me. So, get rid of that note. Anyway, I'm glad that you took care of yourself in that way. Good for you. And I thought, you know, what have I done then to sort of take care of myself? Because you can't survive this without stopping and just resting. And I would say I've spent a lot more time in prayer and just talking to God and conversing with Him. And I would say I've also read a lot of grief books. I really I've loved reading my grief books. I have a bookshelf in my bedroom where, and just even walking near my bookshelf full of grief books just makes me feel better. Which probably sounds weird to somebody who's not a lost mom, but I bet the lost moms that might resonate with some of them. And I have like my two piles, like the stash that I've read, many of them multiple times, and I have the stash that I haven't read yet that I fully intend to, but I just got to work my way through them. So definitely prayer and grief books, and there's one other, what was it? My counseling, going to counseling, both kids counseling, which has been amazing. I take my children there, take one child there every week, and then also counseling for myself. And so that's just a good time to stop and take a deep breath, evaluate where I am. Oftentimes it's just sort of noting, wow, I'm making progress in my grief journey, right? Like I am not, the first many weeks and even months, like all I did was just cry. It was maybe not all I did during my counseling sessions, but it was a lot of it. And now it's not so much that, it's more just, I don't know, digging deeper almost, and where am I at, and